Hi, this is Dr. Yoon Han Kim, and I'm a integrative and functional medicine physician, and I'm an expert in LDN. Today, there was a question in school that I wanted to answer. The background is that this person has had 25 years of chronic illness and pain, and was pretty stable before starting LDN, and had other conditions, perimenopause and hypothyroidism, and this person took LDN, okay, first dose, second dose, and the third dose, and then noticed market emotional change, weepy, highly reactive, persistent shakiness that felt like low blood sugar. But when the person checked the blood glucose readings, it was normal, and emotionally felt like dysregulated, and had to even leave work after having a emotional uh, breakdown. So no other medications, no other lifestyle changes, some job stress, but the stress was already ongoing and manageable. The question to the group was that can LDN cause strong emotional reactions and shakiness even at zero point 0.1 milligrams or 100 micrograms? Has others have early mood side effects that later resolved? Should they push through, lower the dose, and pause the treatment? So this is a really great question because it talks about a problem that is very, very persistent that I see. And it's so easy to avoid, but it's easy to also fall in the trap of doing it this way. So, first of all, this person says zero point 0.1 milligram or 100 microgram. So, some of you may know that I asked three questions. And if one question is positive, is I start with 10 to the minus one, and if two questions are positive, 10 to the minus two. If three questions are indicative or positive, then 10 to the minus three or one microgram. And those are generally how I do it. It doesn't mean that's the only way. It doesn't mean you can't get in trouble. But what I've noticed is that not doing it this way can create a problem. And what I can say is that the the fact that the person was okay, first dose, second dose, third dose, is indicative of me that probably endorphin and depletion and market emotional change. I think that's possible through endorphin depletion. You have to understand that and endorphins are supposed to um, block opioid receptors. But endorphins are also get like a nature's high molecule. In that sense, they are somewhere between serotonin and dopamine. So imagine if you block all the dopamine, serotonin all of a sudden, then you are going to get highly reactive, weepy, depression like symptoms. And I think that the way this person's brain works is an that this person's an observer, a very keen observer, which makes my job a lot easier. And I think that in this case, in my practice, what I recommend is not to just stop it for 7 days and then restart it maybe at 1 microgram. My tendency is that either I calculate, and then if there's any kind of issues, I just start from 1 microgram. And if my 1 microgram is too high, then I instruct them to go ahead and dilute it themselves to maybe nanogram range. So that's what I do in terms of, and that's what I would do. So let me go through some of the questions in LDN group, and let me see the LDN support group. Some of you may know what happened to our LDN support group on Facebook. Through no fault of us, Facebook kept on suspending us, and that has happened to other LDN groups. One of them was not given an opportunity; they were just banned right away. Another, a bigger group that had been around for a long time, they were given two warnings and then suspension the third time. in each and every time they say they made a mistake, but Facebook is very strict when it comes to their policy. So now we have a I am concerned. I don't want I want to keep our group as long as possible. So I didn't do anything. So this is related. This has anyone experienced these issues? I started with 1.5 milligram with few minor side effects, which went away, and then went up to 3 and had major anxiety, and then went back to 1.5 and had anxiety. Stopped for a few days and started again 0.5 milligrams, no anxiety, but a lot of body aches. So it's been 10 days and still experiencing general body aches. I think that's very consistent. I'm going to type here consistent with endorphin depletion. And then I will just give them the link that I created for does LDN can LDN cause endorphin deficiency? Read my blog article. Actually, I'll be politer and say, please read my blog article. So endorphin deficiency, secondary to wrong or too high of a dosing of LDN, is very common mistake, and people suffer like hell. I mean, I've done it because I've taken high doses just to see what happens, and nothing really nice happens. So I don't recommend it that way. So let me look at more new posts on the LDN. It says, "Can I ask question about best practices in terms of titrating down if a person has side effects? Is it is it better to go slow decrease or better to stop?" So by the time you have triggered endorphin deficiency, I think it's better to stop for 7 days and let your body recover. And at the end of the 7 days, your body doesn't recover. I think it's better to just recover longer until you feel normal. So you see the last three suffering, and imagine the suffering these people go through. It's quite a bit, but this can be avoided if they chose another path. So um, this is another group, our Facebook LDN, Facebook compliant group. It says, I've been titrating my daughter up very slowly, about a month in and on, a little bit past one milligram. Did not have any side effects. Has seen some improvement in fatigue, brain fog, focus issues. I'm noticing that she seems to be sleeping later and later, which puts a damper on getting started with homeschool in the morning. Has anyone experienced this? And do you have any recommendations? I think that the only thing you can do, in my opinion, is um, to maybe start it, give it earlier, or give it during morning time, lunchtime. I think that LDN is very individualized. It should be individualized, and everyone's reaction to LDN, you need a thinking partner that can help you. And I know these days people can get medication easily, and there are rent a doctors working for pharmacies, and they just prescribe the medication. But one of the concerns I have is that when you have a problem, those people usually not tend to be super helpful. So we have groups like these, but there's a limit, and I think there's another side effect like that. So to summarize, today's talk really was about what happens if your LDN dose is too high. You start at too high, you get into endorphin deficiency syndrome, and I can link all those things together if you wish me to, but they're on my website. Uh, Not website, the my blog site. My blog site is www.ifmsynergy.com, and that's uploaded on the message site. So today looks like I'm going to cut this shorter because there's been no other questions, and I think the questions today, it's better to make it short and sweet rather than to have a long session. So I'll cut it off right here, and thank you so much, and I really appreciate you. Bye bye.